This is Aging Forward, a podcast from Mayo Clinic about the science behind healthy aging and longevity. Each episode, we explore new ways to take care of our long-term health, the health of our loved ones, and our community, so we can all live longer and better. I'm Dr. Christina Chen, a geriatrician and internist at Mayo Clinic in Rochester, Minnesota. In this episode, we are talking about how our environment and support system impacts how we can successfully age well. And our guest today is Dr. Amit Shah, a geriatrician and internist based at Mayo Clinic in Scottsdale, Arizona. He is an assistant professor of internal medicine, course director of the Senior Stages Geriatrics Curriculum, and recognized nationally for his educational talents as well as mentorship. We are so happy to have you on this podcast today, Dr. Shah. Welcome.
Thanks for having me. It's great to be here.
Yeah, you are the perfect person to have this conversation because as a geriatrician, you have taken care of older adults in the community. You have seen them in their home setting, and you're very connected to all the resources and educational expertise to navigate some of the toughest situations that a lot of us are not aware of.
This is one of my favorite topics. Whenever I teach medical students about how to take a history on patients, it's always one of my pet peeves when they don't go deep into the social history and really ask people about what's most important in their lives, which is not often their blood pressure or their cholesterol level. It's who's in their lives.
Agreed. So our social influences, we often don't think about that, like you mentioned, as a primary contributor to our health outcomes, but they do have tremendous impact. So let's start from the basics here. What are social determinants of health?
So this concept of social determinants of health, people argue about the terminology. I don't love social determinants. It seems very fatalistic and like it's set in stone and you can't do anything about it, which is not true. I prefer the term that some people are moving towards, which is social drivers of health. In other words, there are aspects of the world around us that do a lot for determining our health. And though medicine, regular old medicine, allopathic medicine, and the advances of modern medicine are very important, we know that it's actually been the advances in the rest of our lives that have really driven health outcomes. For example, clean water and good living conditions and all of that sort of thing. And so some estimates are that 80% of our health is actually determined by these other factors, things like our access to good, healthy food and our lived environment, financial security, our social networks, all of those sorts of things really, we know, impact our health outcomes and in a greater degree than what our cholesterol is or our blood pressure is, though those things are important too, of course.
I like that word change. Determinants seems like there's almost no way of changing things, but drivers, there's ways to intervene and have impact downstream. Yeah. You mentioned a few of these examples earlier, but as we break them down more and we talk about access to healthcare, income, education, can you give a little bit more detail behind how this affects the well-being of older adults in particular?
These sorts of things affect everybody. It doesn't matter what age you are. But as you get older, these sorts of things become even more important because you become more vulnerable when there are gaps or holes, or if things can become really tight. For example, finances, right? When you're earning an income, when you're able to hold down a job, et cetera, things can be okay, even if they're tight, or at least you may have the ability to get additional income or take on a job. But let's say you're 100 years old and you have severe arthritis and you're not able to take on the job, you become very dependent on, let's say, a Social Security check or charity care or other things like that. And so these things become even more important. And then inflation hits and then everything gets more expensive and your Social Security check didn't go up as quickly. And so now you start experiencing enormous financial hardships. And so as you age, everything from income, lifetime income, how much you were able to save up for a time when you could no longer be making any more income becomes very, very important. Housing and losing your house or not being able to afford even just the property tax. Your house could be paid off, but you can't afford the property taxes anymore, for example. Or you have used up all of your assets and your only asset left is your house and you start taking out a second mortgage to dip into that, but then you outlive your assets as life expectancy goes up. This is one of these hard things. And so higher educational level and health literacy become a big part of social determinants of health. And this is especially true in immigrant populations that we see, or people who are non-primary English speakers. And as they try to navigate the healthcare system, which is not always the most friendly to people who are not primary English speakers, and access can be important. Like, for example, if you live in a rural area, you may not have the best access to care or not know how to navigate the system. Let's say if you're a veteran and if you're not sure how to access your VA benefits, all of these things impact, as you can imagine, the older individual disproportionately.
Right. I feel like access to healthcare is already hard enough for the average adult, and everything that you mentioned now, like the income background and education, housing, it creates even more barriers for the older adult. You mentioned earlier about the environment. How does the environment and the space that they're living in impact the aging experience? What exactly are we talking about there?
For the environment, it could be the simple as your environment within your home. So I used to do house calls, and so it's amazing what you see when you go into people's homes, from the cord going across the floor or other tripping hazards, a beautiful rug that just isn't tacked down and is a slipping hazard, or poor lighting on a staircase, or a loose railing. Those sorts of things might seem like minor things, but if you're reliant upon those things, or if you slip and you were to fall risks become really huge. So there's the small environment of your own home. There's the environment around you, like safe neighborhoods, or can you walk places? Are you reliant upon having to drive? What happens if you're no longer able to drive? Many of our communities don't have good public transportation. Certainly where I live here in Phoenix is like that. There's not great subway systems or trains or buses that are convenient for an older person to use, especially when it's 115 degrees outside. And so how do you maintain your independence if you don't have transportation? How do you feel safe going out if you think that you're going to have someone steal your purse as you're walking the street? And then, of course, there's environmental changes that we're seeing in our world with climate change and increasing frequency of floods and hurricanes. And if you watch the news, you always see it's always an older person who couldn't get out of their home, who is stuck, who now needs to be rescued, or who unfortunately perishes. And the death rate in natural disasters is higher in older individuals. So environment affects us both locally and globally.
And as we're thinking more about environment, I think the first thing we think about is the environment where they live, like you mentioned, which interestingly can be a very hazardous and unsafe place to be, but also it's where people feel the most safe. And even though they feel safe, it may not be the appropriate environment for them, especially if they're feeling isolated and lonely and just not supported from that aspect. As we're kind of moving into the mental health sphere, how does loneliness and lack of community and socialization affect that health experience?
In the United States, you tend to be a little bit more kind of nuclear family, or I'm going to be independent. There's less people that live in intergenerational households than in some other countries where that's the norm. And so because of that, the older person can very quickly become isolated if they can't get out anymore, or they can't drive, or they lose a spouse or a partner. And next thing you know, they're just by themselves at home. And so this is what you would see a lot of times. People end up, nobody even knows. They're self-neglecting themselves. No one is checking in on them. People don't recognize how much a decline has happened. And so you see some of these really challenging situations sometimes. We know a lot of times that people get socially isolated, and social isolation is a little bit different than lonely. So social isolation is something you can measure, like how many times are they seeing somebody on a weekly basis, for example. People can be seeing somebody regularly and have people coming in and out, maybe even live in an extended family, but they could still feel lonely. Lonely is a subjective feeling, this feeling of I'm connected to somebody and connected to somebody who cares for me. But both of those things have risks in terms of health risks, health outcomes, and other things like that. So you could be socially isolated and not feel lonely, but still have poor health outcomes. So for example, let's say you need to go get a colonoscopy or some other medical procedure where you need someone to drive you back from it because you're going to have had anesthesia. I've had patients who've delayed getting their colonoscopies because they didn't have anybody when they had to wait to try to figure out who was going to take them. And so they were happy to be an alone person, a socially isolated person, but it still was affecting their health outcomes. Loneliness can affect things in terms of feeling chronic stress or depression, or a lack of feeling like there's any meaning left in life. Those sorts of things that are really important and wear on people's immune systems, on their cardiovascular systems, and their mood.
Yeah, thank you for making that distinction, because sometimes, even for me, I'm okay being isolated. As someone who's more, I guess, more of an introvert, I wouldn't mind being with myself for a while, but I think by nature, humans are social creatures, and even the most introverted of the introvert needs someone to communicate with and connect with. That is an important aspect to healthy aging as well. Health disparities, let's touch on that a little bit. There's different types of health disparities, and it may sound like the atmosphere where people are born into or raised into sort of determines your health outcomes from the very beginning. And sometimes we wonder, is that true? Can we change that? And are there steps that we can sort of mitigate some of these negative impacts on our lives as we age?
There's this concept of intersectionality. So let's say being older is one risk factor. Being old and Black or being older and Hispanic is another risk factor in intersectionality. And let's say being older, Black, and of the LGBTQ older population is another thing. And if you see it, it's not just additive, it's almost like a bit multiplicative. Populations where there's this intersectionality, you see the most health disparities. And it's really quite a challenge. It's something that we have to be aware of, certainly as physicians, but we should also be aware of as people in our communities, reaching out and helping communities in need and recognize that there are structural issues why these health inequities exist. I grew up in Chicago, and if you go to the south side of Chicago, in some neighborhoods, in some areas, good luck finding a head of lettuce to buy. They call it food deserts. And you go north side of Chicago and you'll find a Whole Foods over here and this over there and 7 grocery stores within a 5-mile radius, right? This affects things like when you are telling people to eat more healthily, well, how can I even get to a grocery store that will give me the ingredients to make a salad? We have to be very aware that things are not easy in these communities and are doubly hard, especially when someone has multiple factors for health inequities. And there are lots of social resources that are out there that we can talk about. There are community resources. There's oftentimes, in my experience, all these wonderful things, but nobody knows how to access them. So a lot of times patients are looking at their doctors to help them. Doctor may not be the right person. In geriatrics, we believe in interdisciplinary care and having a team that helps. And the best teams I've always been on, it's been the social workers who have taught me these things about how to address social drivers of health, how to get people resources.
And empowering the patient to understand that there are ways we can mitigate some of these challenges and that they are not doing this on their own, and the atmosphere they lived in for the past 20 or 30 years may not be what they need to live like down the line, right? There are proactive ways we can help you live better in whatever deficit or whatever area that you're lacking resources. When we talk about finding healthy support for older adults, what does that look like? And it's probably a little bit different for each person, but overall, what does a healthy support for an aging older adult look like?
It's bidirectional. So I encourage my patients, like, hey, you need to get out of your shell and reach out. It's really important. This is important for your health. There are lots of studies, on this. So for example, people who regularly attend religious services or belong to a church or temple or synagogue or a mosque, et cetera, that their health outcomes are actually better. Now, I'm not going to write on a prescription pad, go to church 3 times a week. That would be silly. But why is that, right? Well, it turns out that socially isolated person who couldn't get to their colonoscopy has somebody from their church, et cetera, that's willing to take them to and from, right? They have something to do. They have a reason to get up on the weekends to go and visit with people at their house of worship. And so religious communities are very important. And we find that with aging, religion and spirituality sometimes becomes even more important for people. And so I encourage that. And we have studies that show that people live longer who have a regular community that they belong to. For many people, that's a religious community, but it can be another community of a gentleman who loves building model railroads. That's been his social network, his community, his reason to get up in the morning. I have another gentleman who restores old World War II planes, and this is his thing. And I think the pandemic really showed us how much of a loss it was when people lost these communities or could no longer do it. But then people innovated and started doing things on Zoom. But I think some community is really, really important. And for those of us who are not in that older group category, for us to engage intergenerationally is really important.
Mm-hmm.
We know how much value there is. One of my favorite ones is the walking school bus. And if you've ever heard of the walking school bus?
I have not. Enlighten me.
Getting your kids to school is always a struggle for everybody, right? How do you get them to school safely, et cetera? School buses, there's a shortage of school bus drivers, but oftentimes the school is just a mile or less down the road, and you see people getting into the car, waiting in those long lines. Well, what if we did a walking school bus with an older person?
Their
physical activity in, they pick up the kids along the way and walk them to school. And it gives them this intergenerational, wonderful exercise in the morning and a connection. And they have the ability to do it because it's 9:00 in the morning when school starts. And it's okay because they're free to do it, even though the parents have gone off to work. These sorts of things can be really cool, some really neat intergenerational program that communities can create. There are things where people go and read to the kids in the school,
Mm-hmm.
and that has shown benefit not just to the children's literacy, but also to the older individuals because of all of the physical activity involved in getting up, getting out, getting to the school, getting back, and the socialization amongst those volunteers. So I think there's lots of opportunities. You just have to get out of your shell and find what is your passion. What do you really love? What's your hobby? Whatever it might be.
Yeah, I'm getting so many just great nuggets of ideas here. But what it sounds like you're summarizing is, number one, figure out what's important to each person, what gives them purpose, what gets them out of bed in the morning. Even though they're retired, they're not doing the same thing that they did for the past 40, 50 years, right? Just to really explore again what will help give you meaning over the next few days or weeks, or just start small and then go big, but also getting creative with how do we help you get to those goals. So as a healthcare provider, you've done a lot of home visits and you've probably seen a lot of situations that most other providers have not. I'd just love to hear more about how you got into this line of work. And if you could just share some of your experiences. For example, what are some situations that you've seen on the job during your home visits, and just what has that been like for you?
I've been interested in this topic for a very long time. I would have to say probably even before medical school, when it was visiting veterans in a long-term care facility at the VA and spinal cord injury patients, that really got me interested in medicine to begin with. And it was hearing their life story, what they had done. Just, I love the story, and I think as a clinician, I'm sure you're the same way. And so I always tell my students, because you can get very jaded and burned out in medicine if you don't pay attention to the story, the social parts of the person. That's where the connection happens. And so I'd had that inkling beginning. And then when I went to medical school, I had one amazing mentor. I call her Mother Teresa incarnate. She really was. And so she did kind of the hardest geriatrics, these patients who the world had forgotten or were really in dire straits because of some of their social drivers and determinants of health, who lived in poverty, who lived in soiled environments and other issues. And I got the opportunity to go out with her, and more importantly, to go out with adult protective services workers, with social workers, who allowed me to tag along with them. And it was the most eye-opening experience. First of all, I was appalled. I couldn't believe that in today's day and age, in one of the most affluent countries in the world, that our seniors were living in such conditions. I also learned that it wasn't about the stuff you hear about in the news where somebody's abusing grandma or stealing her money. That stuff still happens, and that's very important to understand and to address. But most of it, 75% of all neglect and elder abuse, is actually self-neglect. Those home visits were eye-opening to me about how important, first of all, social workers are, but also how much we need to address these things. And then later on, when I did house calls, I also saw how well people live at home, how much families care for it, how much work goes into it. I also learned how embarrassed sometimes people are to ask for help.
Mm-hmm.
I remember a 98-year-old couple, 98 and 100, that I went to go and see in house calls. And they were very, very independent, fiercely independent couple that had lived through a lot of things. And they had a loving family that checked in on them and everything else, but they were too embarrassed to talk about, and then they were losing weight. And so we're doing this whole big cancer workup in the outpatient setting, and people didn't think to ask, do you have food? And when I went out to do house calls on this family, I asked to just poke around, as I often do, and be like, I always like to look in the refrigerator and see, because sometimes people lose their sense of smell. So there was spoiled food in the refrigerator. The freezer was bare. And the source of their weight loss was really just lack of access to food. Their ability to go to grocery shopping and get a meal and all these other things. And they would just occasionally have family that dropped off meals, and they would stretch those meals out because they were too ashamed to say that they were not able to do it because they were so afraid of someone taking them out of their home.
I see.
We got them Meals on Wheels. So it's amazing when you do home visits how eye-opening it is. And so I carry those with me to the office to ask those very same questions. Sometimes my patients have troubles with remembering to take their medicines. How often does this happen to you? Or getting to the grocery store, or sequencing a meal, or leaving the stove on and forgetting about it, and then address them with whatever the underlying cause might be.
I really like that summary of everything that you learned from home visits, which, can take hours to do, but then you're sort of compressing that in a way that you can do it a little bit quicker and easier in the clinical setting of assessing the patient's social situation. Caregivers as well, they often see their loved ones struggling in their environments, self-neglect and experiencing limitations. And then they usually feel helpless because it's like, I want to help, but they don't know what to do. How do you help caregivers advocate for better support for their older adults in their care?
80% of all care that is done in the United States is still done by family and loved ones. It's not paid caregivers or facilities that are doing it. And this is challenging, right? People oftentimes, that sandwich generation, they're raising children. They're also taking care of their aging parents. The stressors on people are tremendous, and it affects their own health. They don't get their mammograms as often if it's a woman, or they're not taking care of themselves or experiencing chronic sleep deprivation, all these sorts of things. And so a lot of times, first thing I do with caregivers is say thank you to them, trying to make sure that they're taking care of themselves, because an impaired caregiver, a caregiver who becomes ill themselves, is of no use to their loved ones. So I have to encourage them to take care of themselves so that they can take care of their loved one, which is their goal. But also, caregivers sometimes do too much. They promise too much. I promised my mom I'd never put her in a nursing home, but things are just becoming too much. And so to give them permission to say, I get it. You tried. You've done a wonderful job, but now is the time for you to be daughter and not bed cleaner, diaper changer. Like, you just have to do that. And so sometimes as a physician, you can provide them some help with creating some boundaries around what they're able to do. But a lot of times they haven't gotten the resources. So you were like, hey, you're breaking your back, taking your mom out of the bed. How about we get the physical therapist to do a home safety evaluation, to assess her for a Hoyer lift, so that we can give you this little dramatic thing. You just pull this lever with a little sling, and now you're not injuring yourself, helping your mom to get in and out of the bed or to change the sheets or other things like that. So I'm always surprised by sometimes how such simple fixes can completely change a caregiver's life. We don't get taught this stuff in medical school oftentimes, and that's using other people to help you, or just to think about it and to connect people to these community resources is really, really important.
Let's just take a moment to thank all of the caregivers listening to this today. Just thank you for being the backbone of care, for just being the angels and the heroes. You are not recognized enough and nearly paid enough for this. In fact, you're not being paid at all. So you mentioned some care resources, including home health, but what are some top resources that people can go to, whether it's online or within their community, to address these gaps in care, perhaps to help their older adult loved ones maintain and build social connections, and some things that perhaps they're not aware of?
There are some amazing resources. So the pandemic has actually done a wonderful job of making things so much more accessible and online. So if someone is taking care of somebody with dementia, my absolute favorite for years resource has been the Alzheimer's Association and their local chapters. There's online resources. There's so much information about how to deal with the long, slow goodbye, unfortunately, that is often dementia, and the years and years of caregiving that people are giving, and how to deal with things as they come along. I also love the oldie but goodie 36-hour day. So that aptly titled book has been around and revised many times.
I love that book.
Peter Rabins and Nancy Mace.
Yeah.
And so that book I have given many times out to folks. So that's for dementia and Alzheimer's care, but that's not all of the patients. So every state and every region has these things called the Area Agency on Aging. And they're called different things in different areas, but they are usually funded by the state, and it tells you exactly what is available locally for you. Phenomenal. Tremendous resources, everything from legal resources to Meals on Wheels for transportation, to this, to that, to names of places, or I need respite care or anything like that. It's really wonderful. There's a newer, I should say, resource that is out there from the National Council on Aging. So you can go to their website, or you can go directly to benefitscheckup.org. And this is one that I had not played around with previously, and it's phenomenal. So you put your zip code in. It's from the National Council on Aging, and you can actually find local and national programs that you might be eligible for. So, for example, with certain electricity providers in Arizona and the heat, you want to make sure that your air conditioning doesn't get turned off, even if you're unable to afford to pay the bill. There are state laws around this. There are programs. There's grants. But how would you know that this exists, right?
Yeah.
So this website, benefitscheckup.org, will actually tell you all the things in all these different domains that you are eligible for, or you may want to reach out for. And they'll even do a consultation with you if this is your income, if this is where you're at, these sorts of things. And then actually completely free, will help to connect you to these organizations. So way better than anything I had seen exist before, because a lot of times it's just overwhelming. You go to these websites and there were just so many things.
Yes, right.
The AARP is really good, and Medicare and Medicaid website. The government actually has things like Nursing Home Compare, and there are also oftentimes ombudsperson programs available for people who are experiencing challenges or difficulties in assisted living nursing homes, those sorts of things. And local things like benefits, which vary state by state, but the SNAP program can be really helpful, and their website can walk people through. And sometimes people don't realize they're eligible for hundreds of dollars sometimes in food assistance, and they're trying to live on a fixed income. And mistakenly, they think because they're getting a Social Security check that they're exempt from SNAP, which is not always the case. So lots of great resources that are out there, but they can be overwhelming.
Yeah, thank you for that summary. That's amazing. I learned something new there too. So we'll try to summarize all the resources that you offered today, including websites at the end of our podcast for all of you to access as well. I feel like when we talk about geriatric medicine and aging, the common theme is that things are always going to get harder and worse for you, but that's not necessarily true. So despite our circumstances and background, how can we still strive to live well? How do we cultivate better living habits or resources moving forward?
First of all, it's not to struggle in silence. I mean, so many times you find out that someone's been dealing with something for such a long time because they're too prideful to ask for help. They think it's a sign of weakness. They worry that someone's going to take them out of their home. They're going to lose their independence, all these other things. But, usually the people who are set up to help with these resources, their goal is not to ruin someone's life or to take away their independence, actually try to maximize their independence. And so I think it's not suffering in silence and recognizing that this stuff is actually really common, that you're not the only one who has struggled with how to make ends meet, to struggle with how am I going to figure this out, to struggle with driving or transportation or feeling isolated. And you really have to have a reason to get up in the morning. That reason, whatever it might be, whatever gives you meaning in life, we know is very important. And it's hard when doors close, right? There's a lot of loss in each. You lose a partner or you no longer can do, I have lots of patients who love a certain physical activity, like let's say running, and their knees give out and now they can no longer run. They can get really depressed. And the people who do best, I think they pivot. And if they can pivot, oftentimes using their social networks or just putting themselves out there again, which is harder and harder to do sometimes. But the alternative is becoming lonely and isolated.
Right.
And your health really takes a decline. And so I think it's sort of pushing people to pivot a little bit, to not stare at the door that's closed, look down the hallway and see all the other ones that are open, and to do those things. Even with significant loss of function, people can still have very meaningful and wonderful lives. I mean, the Paralympics, I'm a big Olympics and the Paralympics fan, and you're just so inspired by people who faced tremendous loss and look at what they've done with it. And some of those say,
right,
this terrible thing that happened to me gave my life so much more focus and meaning, right? If that can happen to younger people that we see, that we put up on pedestals, that win gold medals, that can happen to us regular, everyday people too.
Yeah.
When we experience a loss, small or big in our lives, how do we show our resilience? How do we bounce back? That's a big part of aging. And the people that I see, it's not a lack of loss that is why they've aged successfully. It's their ability to bounce back.
I really love that. That's very inspirational. Do you have any other success stories to share? I mean, obviously, you've done a lot of home visits. You've seen a lot of extreme social situations, both in the community and in your clinic. And, that can be really difficult, but as you've mentioned, really rewarding as well. So tell us more about the fun parts of your job. What makes it most rewarding for you? What do you love about it?
It's been really fun for me just having these conversations, I would have to say. I think sometimes we're reluctant because we think it's not part of doctoring, but I think the evidence tells us it is. If I told you there's an intervention that might make your patients live 7 years longer, you'd be like, give me that medicine. Let me learn about that medicine, right? But then when you learn that the intervention is connection and socialization, and there was some study that tried to equate loneliness and social isolation as equivalent to smoking 15 cigarettes a day. That got a lot of press, of course, but we know that these things actually make a difference. And so I think probably my most fun has been like the light bulb moments that I've gotten from patients when I start talking about these things. It can be everything from simply like I do a pre-retirement counseling, like, hey, we should start talking about these things. You need to have something figured out because, playing golf is going to get really boring, after a bit, especially our old patients, when they're in their 90s and 100s, they experience so much loss. And I remember one patient I have who is on his third group of golf buddies because he's outlived 2 groups of golf friends.
Oh, gosh.
And it gets harder and harder each time, but every time you're just kind of you got to do this. I know you're healthy and your new golf friends are 20 years younger than you, but it's just going there with the patients and connecting it to their overall health, which I think has been my absolute most fun thing. So that's why I kind of use it you got to get out of your shell, It's amazing how one little thing can completely make things a lot better. But my dad lives with us, my mom passed away, and so he's with us. And it took a long time, even with my in-laws living here in town, trying to introduce him to people and whatnot. But for him, it was this group of other widowers that he hangs out with, and they love to play ping pong. That's been their thing. And they're all, older Indian men, all immigrants, and they call themselves a singles group. Friday nights go out, and that was a thing that finally got him out of this kind of constant spiraling of being thrown out of his element and moving across the country from Georgia to here and all of that. And then also some of these seniors travel together. So you can see that over time now, he's just a much easier person to be around and isn't so grumpy. And then because of that, now you're going on a trip, you're getting out of the house, you're exercising, you're getting up on time. It doesn't have to be something dramatic. And so I think that there's this cascade of things that happens to people as they get out.
Right. Very true. My last question for you, Dr. Shah, what does aging forward mean to you? And how do you personally try to age well? What are things that you like to do to kind of stay on task here?
I love what I do. It gives me a lot of meaning in life and, certainly makes me feel very fulfilled. But I am definitely a workaholic. You can sometimes do too much of one thing. And so I have learned from my patients the importance of embracing change or putting some boundaries around things. And it's always a work in progress, but I think that's very important. But trying to get involved in things. I love reading. So being involved in a book club or something like that. I'm trying to do better with my physical activity and getting to the gym. Making that a priority is something that's a constant struggle for me. But I've learned, hey, maybe I should pay a little bit more attention to that. But I think the importance of family, friends, community connections, paying more attention to that, because when we get busy, we sometimes let those things go on the wayside.
Well, Dr. Shah, this has been such a moving conversation. I'd say, I think just the realization that our ability to live well within our means with access to healthcare. And I hope that we all have learned there's always something that can be done. So thank you so much for having this dialogue today.
Thanks for having me. It's been a pleasure to talk about my favorite topic.
That's all for this episode. Hopefully you're feeling a little bit more informed, inspired, and empowered. If you have a topic suggestion for a future episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Aging Forward episodes and resources, head to mayoclinic.org/agingforward. And if you found the show to be helpful, please subscribe and make sure to rate and review us on your podcast app. It really helps others find our show. Thanks for listening, and until next time, stay curious and stay active.